Hey everyone, and welcome. Today we're going on a pretty incredible journey, looking at the last 40 years of dentistry through the eyes of just one dentist, a guy named Tony. In his career, you'll see, gives us this amazing ground-level view of a profession that has been completely, and I mean completely, transformed. But first, let's start with right now, because as Tony himself says, dentistry is in the news for all the wrong reasons. You hear about a crisis, about people not being able to see a dentist, about a system that's just under massive strain. So how on earth did we get here? Well, to figure that out, we've got to look back. And wow, when you look back, the change is just staggering. I mean, think about it. In the 1980s, you advertised your practice with a brass plaque on the wall. That was it. Patient records, they were actual paper cards that, as Tony remembers, were literally bulging out of their folders. Fast forward to today, and we're talking digital marketing, cloud-based everything, and AI that can diagnose an X-ray better than a person can. It's a whole different universe. So let's rewind the clock. Let's start Tony's story back in the early 80s, right after he qualified. The world of dentistry he stepped into seems almost ancient now. Everything was hands-on. Everything was analog. Now, get ready for this number, because it is just mind-blowing. In the mid-70s, dentists were performing over 1 million general anesthetics on kids. 1 million. Tony had to do one of these sessions in his very first job, and he described it as simply horrific. It was so bad, in fact, it was one of the main reasons he quit that job. And you can really see that analog world taking shape in his early career. He qualifies in '82. A year later, his only form of advertising is a single line in the yellow pages. Can you imagine? All the notes are crammed onto these little cards. And by '95, he's so dedicated to NHS work that he buys a whole house and converts it himself. This was a world with zero computers, where every single thing was done by hand. And then, around the mid-90s, things started to change. The first wave of technology began to trickle in. Computers started showing up in dental practices, and well, they were about to change absolutely everything. All of a sudden, dentists are going from old-school DOS programs to Windows. Just using a mouse was a brand new skill. Digital X-rays came in, which meant no more squinting at tiny films with a magnifying glass, and things like intraoral cameras, a total game changer. For the first time, Tony could show a patient a picture of their own tooth on his screen. It was amazing for communication, but it also brought its own headaches, like trying to transfer data with these clunky old ASCII files. But technology wasn't the only new pressure. A decade after he opened his own practice, in 2006, the NHS rolled out a new contract. And in Tony's very direct words, it screws you big time. He said it nearly bankrupted him. And worse, it created a system full of these, perverse incentives that would totally warp the focus of his work. And this right here is where we get to the absolute heart of the problem. This new system created a fundamental conflict in his career. A system that paid dentists for treating problems, for doing fillings and extractions, but not for preventing those problems in the first place. Which led to this central question. As one of Tony's friends put it, to be successful, you've got to tick the boxes. The goal shifted from focusing on what's best for the patient's long-term health to just hitting targets and claiming for activity. And if you want to know how far that box ticking could go, listen to the story Tony tells. He knew a dentist who, for 2 straight years, fraudulently claimed a dental emergency every single morning and every single afternoon, just to hit his targets. And the penalty when he got caught? He was just told to stop. That's it. And here are the devastating, real-world consequences of a system like that. These huge differences in child tooth extractions between regions, 5 times more common in some places than others, these scream failure of prevention. If the focus were on keeping kids healthy, you wouldn't see gaps like this. But the system wasn't built for that. So after this whole career spent navigating, and a lot of times fighting, this system, Tony's focus shifted in retirement. He started working on a totally new vision for dental care, one that uses technology to put the power back where it belongs, in the hands of the patient. He calls it disruptive innovation. And the core idea is pretty simple, actually. It's about using the technology we all carry around in our pockets every single day, our smartphones, to completely flip the old model on its head. Instead of a top-down system that revolves around the clinic, you create a bottom-up system that revolves around you, the patient. So what does that actually look like? Well, it starts at home.
You use an app on your phone to monitor your own oral health, maybe track your plaque score, or even do a guided self-check for things like oral cancer. If you need some advice, you hop on a tele-dentistry portal and talk to a professional remotely. This means the clinic, the most expensive part of the whole system, becomes the last stop, not the first. It's saved for the complex stuff that really needs a dentist's hands-on skill.
And look, this isn't some sci-fi future we're talking about. The technology to make all of this happen is already here, right now. We've got AI that can read an X-ray more accurately than a human. There are portable scanners that can create a 3D model of your mouth from your living room. And the camera on your phone, it's more than powerful enough to do the job. So Tony's 40-year journey shows a profession that has been totally revolutionized. But his vision for the future really leaves us with a huge question. The tools to take control of our own oral health are now literally in our hands. So isn't it time we revolutionized how we, as patients, think about our own teeth?